Before you agree to spinal surgery of any type, when you're dealing with disc issues, arthritis, stenosis, anything like that, and I'm talking anything that's not an acute traumatic accident that needs probably life-saving interventions, then there's a list of questions you need to ask your surgeon and your doctors before you agree to doing it. Now, sometimes surgery is very necessary, and as a chiropractor for 20 years, I've seen some cases that absolutely needed spinal surgery, but it's a very, very small percentage of the people who actually get it done. And I would guess that the failure rate, meaning 5 years later is the person better than they were before the surgery, is probably close to about 90%. So it's not something you want to take lightly. There are obviously risks that come with it. So what questions would I ask as a chiropractor if I was going to get surgery? And keep in mind, I've had 2 very serious disc herniations in my low back in the last few years. I mean, 4 years ago, 3 years ago. And not once did I contemplate surgery. I was bedridden for 3 weeks and I'm perfectly healthy, no issues left from the disc. But if I'd gone to a surgeon with how bad it was, they absolutely would have wanted to cut me open. So these questions are serious. You have to ask these and make the right decision for you, because it's very rarely spinal surgery being the right case. So the first question I'd ask the doctor is, what's the long-term success rates of this surgery specifically and low back surgery in general? Because if I hear failure rates of 80 to 90%, I'm a little nervous. If they tell you the success rates are 90% plus, they're either lying or they don't know, because no one comes back to them after the short-term future of getting that surgery done. So you need to know and understand that. The next question I'd ask is, what percentage of people that you operate on for this condition are still happy with the results in 5 years? Maybe it's not considered a success rate, but how many are telling you, oh my gosh, doc, I'm so glad I did that surgery 5 years ago? You need to know what the risks of the surgery are, obviously, and that's one thing that the doctors are normally very good at telling you. But what are the risks you face if you don't do surgery? If you have a herniated disc, but it's not causing hard neurological signs, meaning you're losing bowel and bladder function or anything like that, what are the odds or the long-term risks that you'll have permanent damage? If they're not that high, why would you rush for surgery? You always have that option in your back pocket anyway. You should ask, what are the odds that it will fully clear the symptoms in the short and long term? If it's not likely to clear all the symptoms, you want to make sure you try everything else before you do that surgery. Then you want to ask what risks this doctor specifically has seen after the surgery and how often those happen. Maybe they've been a surgeon for 20 years and they've only lost one patient became paralyzed and they've done tens of thousands of surgeries. That's pretty good odds. But if they've had 5 cases get paralyzed a year, that wouldn't be so hot. This is a really important one. You need to ask, what's the chances that I will need more surgery if we do this first one? The reason I want you to ask that is because even the ones that come across as less invasive, even though it's still spinal surgery, so I can't believe we call it that. Quite often you'll start with a microdiscectomy, meaning they'll shave some of the disc off. You need to go and research the odds of how often that leads to a fusion or further microdiscectomies further down the road. The odds are pretty shocking on that, so you need to know what you're signing up for. How many people who present to you, doctor, with similar conditions do you operate on? Is it 100%? And then you need to make the choice yourself by speaking to other practitioners and doctors. Should it be 100%? So if you go to one surgeon who says, oh, 100% of these cases I would operate on, but then you go to another who says 75% of the time is the case, I'd be a little nervous about that one who said 100%. You definitely need to ask, how many of these cases do you send out for extensive conservative care first before we go under the knife? Because I don't mind if someone's literally exhausted all their other options and they still need surgery, I can stomach that. If you've literally tried everything else and you've tried it for a long period of time, great. But if you haven't tried conservative care and you're going under the knife immediately, to me, that's not a smart move. What percentage of your patients in general require low back surgery or neck surgery, if that's what you're going to them for? And then you can ask again, what percentage for this specific condition? I know we just covered that, but it's worth saying it again. But I also want to separate those, because in general, is this surgeon always doing surgery, or are they very, very conservative? Don't settle for them saying, oh, I'm conservative, I only do when I need to. Ask them what that means, because if they say conservative, but then they operate on 90% of people, that's not conservative. You also need to ask, will I lose any function or my quality of life by doing this surgery? And will it put me at risk for further issues? For example, if you get a fusion done, you are far more likely to get arthritis above and below that fusion. And if your surgeon is really switched on, they'll tell you to go and take care of that with chiropractic, PT, all these things after the surgery's done in the long run to make sure that doesn't happen. But if they say, oh, there's nothing else you can do, they're just thinking about their surgery and nothing else. I would also ask, is there anything I should do after surgery to give me the best chance of success and not have recurrences? Just talked about that. You get a fusion or even a microdiscectomy. You still then want to go and have conservative care to make sure biomechanically everything's moving as well as it can. Ask them, are they concerned that multiple health agencies have shown in the data, in hard research data, that spinal surgeries are performed way more often than they should be. This number in some research says 50% of surgeries shouldn't be done. There's some that show as high as 90% plus of surgeries, especially low back surgeries, should have never been done in the first place. That's a really important thing to know. And if the doctor doesn't have concerns or just blows that off and poo-poos it, you need to go and find a different surgeon. Hey, Dr. Rodney here. If you want to get my free PDF, 5 hacks for boosting your immune system, just go into the description of this video, click on the link, download it, and if you have any questions on it, just send me a message and I'll help you out with it. Probably the last thing I would ask, although there's a lot I've left off here, what would I need to do for you to agree that I've tried absolutely everything before we decide on surgery? And if they say, well, you've done 3 weeks of PT, it didn't get better, you've had 6 weeks of pain, that's not time to decide on surgery. There are some red flags. If you lose bowel or bladder control, that's an emergency and you probably need surgery immediately. But if it's back pain with sciatica or neck pain into the arm and you're not having major muscle wasting, you're not paralyzed, you've got decent movement, but you just have a lot of pain, a lot of numbness, a lot of tingling, you do actually have some time on your side to try a lot of other things. So they're the minimum questions I would ask as a 20-year chiropractor before I would even consider letting anyone go near me for spinal surgery. And again, keep in mind that I've had very serious disc herniations twice. One of them had me bedridden for 3 weeks, and I am 100% recovered without any surgery. I didn't use any medication, and the majority of disc issues that I see can get to there as well. And I see a lot of serious arthritis and stenosis cases where those people think they're going to be in that kind of pain forever. We can't always get those 100% with conservative care, but the rates of doing better with conservative care far outweigh surgery in those cases too. So if you've got any questions on this, just leave a comment below. It's always easier if you subscribe first, because then your comments will show up to me with a higher priority. So hit the subscribe button, then leave your comment below, and let's make sure we're asking the right questions and the smart questions before we go under the knife for something that can be very serious, which is orthopedic or neurological surgery done around our precious spine, spinal cord, and nerves.